So I'm a pediatric oncologist in Southampton, and what I hope is help you with what I think Mandy said and makes you feel how overwhelming it is when your child is diagnosed, let alone with cancer, but with neuroblastoma, which is so complex. For some people, it is like a huge cloud that is sitting above their head that you just can't get through. And for some parents, they want to know more and more information, and you get deeper and deeper into a black hole. But how do you navigate this journey, which is life changing for you as a family, but more so for your child, but at the same time, maintain yourself through this whole thing and maintain your family? So, let me clarify, first of all, what we mean by second opinion and how does a neuroblastoma advisory panel in the UK act as a resource for you in that manner? How can this panel actually help you as a parent? But also, I understand completely this is a UK resource, but give you some pointers as to how you can actually ask for second opinion, whether you're in the UK or any other place globally. But I guess for me, it is finally the reflection on understanding what matters to most of the families. So, what do I mean by a second opinion? It could mean multiple things. When you're in this time point, like Mandy described, overwhelming, and you just can't make the right decisions about where do I go, what information is right, just asking another specialist to review your child's diagnosis or what situation is itself can constitute a second opinion. But let's not forget, childhood cancers and neuroblastoma is complex. And as a part of good care, we as professionals will always be seeking other professionals' opinion because we don't have egos about this. Ultimately, we care for your child. So automatically, this is something that already happens if you're not aware. Or it might be at those time points that we just heard, like, for example, diagnosis that is difficult, or where changes in treatment have to take place because your pathway has gone from green to red, or it might be at the time of relapse when we as professionals also seek what is it out there in the UK, which we know is going to be quite limited. But how do we help you in terms of knowing what else is available around the world that might be relevant? So, why do families seek second opinions at all? It is basically so you want to reassure yourself that the diagnosis and the treatment plan is the best for your child at that time point. Obviously, like we heard, it's very, very difficult to know what is the best and where is available options, and if there are clinical trials available for your child that you're not aware about. Sometimes, as we said, that information is so much, and put the whole thing into a chat GPT, it can literally throw off a lot of things. But how do you clarify that? Who is going to explain this to you and break it up in a language that you understand? That is, again, something you can seek from this. And as we said, it's these various time points trying to make sense out of that whole cloud there as to what is really relevant for my child and for my family. So the National Neuroblastoma Advisory Panel, I'm really proud to say, it has been a conglomeration of multiple multidisciplinary team members, and we've been running it successfully now for 9 years nearly in the UK. And very briefly running through what the membership is. So we have core membership of 24 experts on this panel. And as you can see, there are multiple professionals on this who have their multidisciplinary role, starting off from ourselves as pediatric oncologists. We have the radiologists, the surgeons, people who are immunotherapy experts, who have expertise in the new agents. And let's not forget our radiation oncologists. In addition to that, we heard Helen Pearson's name being mentioned. She too comes onto this panel as the nursing representative. However, we do not have a histopathologist, but we have not found that being a compromise on this. We have a tremendously helpful admin support at the moment to help us do this job. But what we've also helped in this process is we invite sometimes other pediatric oncologists from other centers, as well as we have trainees who have very much elaborated the educational aspects of this. So this is a virtual meeting of professionals, and this is hosted by our hospital, which is the University Hospital Southampton, in the auspices or umbrella of the Children's Cancer and Leukemia Group, or the CCLG. We meet twice a month, every second and the fourth Fridays. In fact, the next meeting is tomorrow, and we meet roughly for about an hour. We say 1 hour, but you can see most of the time we overrun because everybody wants to do their job and do it well for you. And try to maximize it and discuss about 4 patients, sometimes 5 patients per meeting. But what I would like to highlight is we have an advisory role only. This is not an MDT. So what we feel that we should be achieving from this is offer you support, and also offer you support in your home environment, meaning with your clinician. So that, as we have said, it's a shared decision making finally as to what is best for your child in that particular situation. And ultimately, it is aiming to improve the outcomes. So, what are our processes? So, we have an infrastructure that is well established. As I said, it's a virtual meeting, and we do not invite the parents, and I'll mention the reasons later, but also how you can overcome that. So, we have terms of reference that all of the clinicians are aware, and we regularly educate. Apart from our neuroblastoma experts, all of the pediatric oncologists in the country. In fact, we've literally come out of a very successful education session over the last 2 days, highlighting how we work and how they can come to us. In addition to that, we have a very detailed referral form, which will give all the details of your child with regards to the presentation, regarding the scans, investigations, biology, which is right now very, very important, but also what treatment has taken place and how they've responded so far, so that the better the question that is asked, hopefully you'll get more clarity on the answers. And obviously, we do need to see the imaging, so the imaging also comes over, which is relevant. Ultimately, it is your clinician who comes over to the panel virtually and presents your child so that we have a detailed discussion and make sure that the outcomes from this are then disseminated, meaning we send the minutes back to your consultant. So please request them to show you the written minutes that are sent back to them. And we've also requested them to put it on your electronic document, so it is there for you to refer back to even later. So what is our remit? We hope we can continue to provide this advice, especially in these complex situations where your child needs multimodal treatment. Or it might be just you want to be reassured that your child is getting the best possible care and you've not missed out on anything, like a second opinion. But our other bigger remit is we want to support equitable and evidence-based access to specialist therapies all across the UK, and not just make it a postcode lottery depending on which part you're coming from. And obviously, we are heavily emphasizing on recruitment to whatever eligible or existing clinical trials, or giving you pointers as to what trials are upcoming. But we will be honest in saying these are the ones that are in the UK. And if we do know there's something abroad, we do mention that, but it will be ultimately a discussion you'll have with your local team as to how you can access that if that is valid. So in other words, we hope can enhance your experience in care, but at the same time contribute to education, not only yourselves and the professionals around, but even ourselves. As professionals, we continue to learn. But we have also contributed this way to audit as well as research in terms of many projects taking off from this that has, for example, been adult neuroblastoma, which now we have more and more adults bringing patients to us because adult neuroblastoma world doesn't exist. So ultimately, how does this panel help your child? So it is to provide the expert review of your own child's details and care in one place. So you're not going to different places to find out what is the best chemotherapy, what is the best surgery, do I need to go for radiotherapy, for example. Ultimately, it's the consensus recommendations from multidisciplinary experts that is going to be given as a complete total single opinion as to how to proceed forward. Additionally, awareness for yourself in terms of what's available in the UK, but also within the international arena of some advanced therapies. We are quite keen that we move forward. So we have a performance analysis as well as an annual general meeting on an annual basis, of course. And in fact, that is what we had yesterday, where we go back and reflect on the cases we've discussed, which centers have referred to us, some of the subgroups we have spoken about, and have we given the opinion and what have they done with that opinion. So in other words, feedback is something we have collected in the past, but we will continue to collect. So that is where I think, even though you feel you're not attending, you will be asked as to how the opinion was shared with you. Was it what you expected, did not expect, and how it changed the outcome of your child? And I'll just run through some of the specific examples where that was quite relevant. So this is just to give you a rough idea over the past years, how many referrals we've been having. And as you can see, constantly in the past 3 years, we have anywhere between 75 and 78 referrals. And many of these come through the panel, but sometimes because we have this meeting only twice a month, it is not adequate in a timely fashion for some of the parents. In such situations, we also do it by email, which we have counted in. You may think, well, my child has been discussed once. Maybe that is all, is it? Or can I go in again? What we are interestingly and increasingly seeing is that we are now having patients being discussed not once, twice, three, or even four times. In other words, follow up discussions are also taking place at different time points now. And definitely, I would encourage you to ask your clinician about that. And roughly in the last year, you can see about 48% were almost follow up, meaning they were being discussed for more than once. And the rest of the 52 were new patient discussions. And this is just to show you a map. We have 21 centers across the UK, the Children's Cancer and Leukemia Group, and all of them have referred patients to us. And roughly, just to give you some numbers, over the past 9 years, over 526 patients, or rather episodes, have been discussed. And many of them, especially now almost coming up to 50%, more than twice, and on an average of 4 a month. It does not matter which type of neuroblastoma your child has. Obviously, high risk would be the most important one that has the most challenging decision making. But roughly, you can see the high risk neuroblastoma, the refractory and relapses are. The relapses are roughly about 35% of our discussions as to what do we do next, second line, third line, fourth line treatments. And roughly a third of these patients are refractory patients, meaning they haven't responded to initial treatment. So, how do we go forwards? But let's not forget 50% of the patients with neuroblastoma diagnosis have the low intermediate subtype. And even those can be challenging. And we've had about nearly a third of those patients being discussed in this panel. So the questions are very, very critical in terms of what is your question. So the better the question, the better the answer. And so we have subdivided our questions into, is it a surgical question? Does it relate to radiotherapy? Does it relate to chemotherapy? Or is it a combination? And hence, we try to tease out what is it that is relevant for your child, but you speaking to your consultant or your consultant realizing these are the important things is what's discussed. And this is roughly the percentages of what we get. So I just like to run through two examples because we talk a lot about what about next chemotherapy, which trial. But there are two other resources that the panel offers, which is local therapy. What you will realize is it's also surgery and radiotherapy that contributes to the cure of your child in the context of high risk neuroblastoma, and surgery definitely in the context of low and intermediate risk neuroblastoma. So, what we have done is we have now designed a performer, plus we're going to be asking your local team to give us the specificities of some of these questions so that we can come up with answers because we have 5 surgeons as experts on this panel who are very, very experienced. Simple example being, is it regarding the feasibility of surgery? Say, for example, your local team says surgery is not possible right now because A, they haven't responded very well to the initial induction chemotherapy, or it is wrapping around big vessels, and so we are going to cause significant morbidity. Or they may say, well, actually, it's infiltrating. For example, it's very close to the kidneys and we're worried about it. So simple things where you need to understand, and is it the best opinion in terms of surgery for your child or not, is something we offer. And let's not forget, in the relapse situation, a surgeon is needed because we want more tissue. We want to understand more about the biology. And certainly there is the SMPs2, which is a new study, which is also characterizing these molecularly so that we can direct targeted therapy. Sometimes it is about the safety of the surgery, and in such situations, we open an open forum. Please come and discuss what your thoughts are, what your concerns are, and let's see how we can mitigate it and how we can discuss about it. Because sometimes it's not just one option, there may be two, three different options. And surgical risk factors, like I described, close to vessels or important structures. We may come back and ask your local team to do more scans because we want to understand the tumor better to decide, is the surgery really possible, or actually is it an unresectable tumor? And sometimes, if it is because of issues with the kidney, how do we go about renal conservation, for example? And lastly, in some situations, surgery may actually not be possible. And in such situations, what are your alternatives? Like, for example, should we go for a very large biopsy? Should we go for embolization? Or is there a role for combining chemotherapy and some radiotherapy in such situations? In other words, please ask specific questions when you feel uncomfortable that is this the right decision. So, in other words, we need the imaging. Plus, we have also encouraged your local surgeon to come along so that it can be a helpful discussion that once they come back to you, they can say, well, this is what 5 other experts in the panel said, and therefore, this is how we can look at it going forwards. Similarly, with radiotherapy as well, remember we need to know whether your child is eligible for protons, eligible for higher dose, and therefore having those discussions early is quite important. And this is another valuable, you can say, resource that we offer. And once again, we invite your local clinical oncologist if it is from your local center, but there are clinical oncologists already on the center who do the protons from UCLH here, and obviously your own surgeon. So, in other words, how does this panel really help you in this whole quagmire, if you want to call it, of decision making? It is to provide you some options when you're at crossroads, which is reliable, evidence based, and perhaps coming, we hope, from the best of the experts in this country, but also who are some of the international experts. In this process, we want you to feel comfortable with your local team when they are explaining the choices and uncertainties, having talked to us on the panel. In that way, we hope we can strengthen the trust, especially when the views of your team own MDT is the same as what we do, or if it is different, try to understand with your team why the difference is so that you're all on the same page, but actually go ahead together. So if you would like to ask for a second opinion, I would say this is perhaps where I would be directing you to go about this process. So first of all, ask your own consultant, pediatric oncologist, can my child please be discussed on the NAP? It doesn't matter when. If you feel you want just that second opinion to reassure yourself, we are very welcome, or rather, we welcome you for that. Or you might want to say, we are thinking about a second opinion. What do you think is the best way to go forward together? So you will already know, but I would like to highlight there are already second opinions existing within the NHS. Your own local MDT, that is multidisciplinary team meeting, will be discussing your child. But sometimes you do require that extra reassurance by making sure you have had another tertiary center look at this. And of course, we as a national panel is also a resource where we are bringing multiple center expertise into this. And what I would also suggest is please ask once you have known the child has been discussed in the panel about wanting it in writing. Yes, it's easily said, but you might still say, well, it really feels hard to go back to my consultant to actually ask this because somehow I don't feel comfortable. In which case, you might have a better, warmer relationship with your clinical nurse specialist, for example. And let's not forget charities, big charities. And definitely for me, on this forum, I would put out Solving Kids Cancer. They have done stupendous work in navigating you through these difficult situations and supported us as clinicians as well in that process so that together we can move forwards rather than you having to do alone. I'm quite conscious all of what we have said is within the UK, but what I would like to reassure all of our international families is the same process. Contact your own oncologist. And being a world where we all work together in collaborative groups, such as the SIOPIN as well as the COG, we do have experts in every country who would actually want to be involved in such situations. So get your oncologist to approach them. Seek what the formal route of opinion, second opinions you can obtain from your own center, because every center will have that process. And if you don't know it, find out. And let's not forget charities, national, international, will also help you in that process. And the power of parent group has already been explained to you. But as we said, just be careful about the practicalities. Like, is it a pure advisory route you're going through, or has your child got to move for the local treatment? What are the costs? And if this is something your local center can't provide, go back and ask them, is this something you are willing to share with us? Because ultimately, it's the responsibility of the local team as well. So if you're trying to prepare for a second opinion, I would say these are perhaps my top tips. Write down your top 3 questions. Gather as much of information as possible regarding the staging, the diagnosis, the test results of your child, and then ask your local consultant who will discuss your patient and how and when will you hear about these outcomes wherever the second opinion is. And when they do give you that information, please, whether it is virtual or in person in consultation, try to take somebody else with you as possible, because that helps with the note taking as well as remembering information, because 4 pairs of ears is always better than 2. And remember, you do not need to make any decisions immediately. Take it home, digest, think about it, speak with your families, and then you can make some decisions in a shared way with your local team. So I think I will end by saying what matters most to families is having that clear, honest explanation at various time points, such as diagnosis, the prognosis, as well as what are the options. Feeling listened to and respected and being asked what matters the most, I think is really crucial. And we are trying to help you there. Consistency and coordination when you have to navigate between so many teams is difficult, and we hope we can achieve that. And ultimately, it is giving you that confidence that you're not missing something that is available out there that you do not know about, is something we also aim towards. Last but not the least, this is emotionally draining. Practically, you need all of that support in a number of ways: psychological, having a social worker, charities, and peer parents. And we hope we can do that together and not yourself in isolation. So, in summary, I would like to say second opinions are a normal part of what I would describe as good care in complex cancers, so that we can not just feel confident ourselves as professionals, but also y'all that it is the right decision. UK has this resource of the NNAP, where we are able to provide expert multidisciplinary input for your child and support you through your local team in order to do that. Anywhere you are, it is okay to ask for a second opinion and to take time to think. So do not hesitate to do that, because your questions are ultimately central to your child's care. And let's not forget, you are the advocate for your child and you have that parental responsibility. And we definitely respect that. And we want to support you there.